And so let me tell you a little bit about Lori. If you don't know Lori already, she is an elder law attorney, and she's a member of the National Academy of Elder Law Attorneys. And she didn't put how many years of experience, but I know she's got tons of experience and personal experience too. And she serves on the board of the Hawaii Pacific Gerontology Society and some other boards. So we are just so excited that she's here, along with Mike, who is going to be speaking too. Mike is an RN. He's going to be speaking after Lori, and Mike is a certified care coordinator. He's an elder care coordinator, and he has 28 years of experience. So this is wonderful. We've got all these people that are going to be helping us with all this experience. And he is also an Evergreen certified dementia care specialist. So that's good. And he carries a national board certification in case management. So we've got some great speakers and great folks that have wonderful experience to help us. So questions at the end. And if we're good with everything, housekeeping, just make sure you're on mute. And I'll just send it over to Lori.
Very good. Thanks, Tanya.
You're welcome.
And thanks everybody for taking a little time out to join us with this. You may be wondering why in the world, elder care, you kind of think naturally, of course, you're going to hear from an RN, case manager who understands elder care, but why in the world are you going to hear from an attorney? I just wanted to help orient you. Many elder care decisions are going to impact other areas of a loved one's life, principally finances, because there is a cost associated with various levels of care. And it's also going to impact the legal documents that they may have created that have named trusted agents to help carry out their wishes, to help pay their bills, to help make medical treatment decisions. All of this is involved in what we call elder care. So let me figure out how I can move my slide. Okay, I'm having a little, oh, there we go. There we go. So elder care is an umbrella term, basically. It covers a lot of areas. You would naturally think, well, the geriatrician offering health care, medical care to an older adult, that's elder care. But so is the social services work, the coordination work that's done by a social worker. And many geriatric practices do have a social worker assigned to them to help an older person connect with social services that can benefit them. But it also includes personal care. And one of the first levels of care we talk about is what's called custodial care. This is a base level of care that's intended to help provide non-medical needs or non-medical care. There's a higher level called intermediate. There's skilled nursing care, which you might assign or you might associate with nursing home level of care. And there is also, again, the services that are offered to older people. That's also elder care, services such as assistive technology, the motorized scooters and hearing aids, mobility technology, transportation, handy vans and medical transport vehicles, and many, many other things that fall under elder care. Our focus today is going to be on custodial care, intermediate care, and skilled nursing care. These are called levels of care. And forgive me, I'm having a little logistical trouble finding where I move my slide. Professional caregivers all fall into a category, a level of care depending upon their education, their training, and their competence. And oftentimes, this begins with the need for care, begins with a evaluation of whether or not they're having difficulty, an older person is having difficulty with or has an inability to perform what are called ADLs. Now, this might be the result of a progressive illness like Parkinson's or a form of dementia. It might be as a result of a health event like a stroke or a bad fall where you break your hip and your mobility is impacted as a result. Or it could simply be as a result of advanced age. So what are ADLs? Well, ADLs are activities of daily living. These are the things that we all get up and do every day. Get up, get dressed, maybe take a bath first, use the bathroom, make ourselves breakfast and feed ourselves, and moving around, getting up out of a chair, moving across the room, getting into bed. These are all activities of daily living. So as a person begins to have more difficulty with these things, with getting in and out of the bathtub or the shower, and it's a slippery place, and they're worried about falling, or even feeding themselves, as it happens with oftentimes with people who have Parkinson's. These activities of daily living are critical to being able to get through the day. And so these are the first things that are looked at. There is a second category of activities of daily living that are called instrumental activities. And these too may trigger a need for care. These are things such as meal preparation, house cleaning, even if it's just a little bit of housekeeping, vacuuming, dusting, getting the laundry done, going out to get groceries, being able to walk long distances more than just walk across the room. And then very important, managing medications properly. Are medications being taken as they were prescribed? Are they being forgotten? And managing finances properly. Are the bills getting paid? Oftentimes you will see a stack of paperwork sitting on the desk or sitting on a table, unattended. It's a sign that there may be bills that have not been taken care of. Very, very common thing to see in an older person's house, somebody who is losing the ability to manage these things. So getting back to these levels of care: custodial, intermediate, and skilled nursing. Let's talk about first the lowest level, custodial care. There are basically two levels of care here that are serviced. The lowest is generally called companion level or homemaker level. And these are wonderful people that will come out to offer companionship, but they also offer, they don't just sit around. Some people have said, you mean they're just going to sit around? No, they can help with light housekeeping. They can help get a meal prepared, warmed up. They can offer medication reminders to people who might forget. They can transport an elder, perhaps to the doctor or out to pick up groceries. And they can just be there to offer some companionship and some supervision. This becomes more important as people become isolated if they're living alone in their home. Once a need for help with the ADLs presents itself, then you may need to move to a slightly higher level of care and need to have not a companion caregiver, but a nurse's aide. At this level, there is hands-on personal care. Sometimes these people are called home health aides. There are training programs and licensing for people that go through training programs. You can become a certified nurse's aide and become licensed with the state. But whether or not you get that certification, the training will generally help you become acquainted with providing help with all the ADLs, as well as some other things like oral care, making sure a person can brush their teeth adequately, range of motion exercises, and again, medication reminders. I might note here that none of these caregivers or assistants, as we sometimes call them, are authorized to give you medications, give your loved one medications to take. They're only authorized to remind, if they are asked to do so, that it is time to take your blood pressure pill or some such thing. It is the responsibility of an overseeing nurse, an RN assigned to the matter, to delegate authority to the caregiver to make that medication reminder. So this is not provided by someone who doesn't have adequate medical training. They are supervised by nurses. And of course, the cost for this kind of personal hands-on care is, as you would expect, higher than with a companion level or homemaker level caregiver. This leads us into intermediate care. And this is a blend of both custodial care and supportive nursing care. And so at this point, I think you probably would like to hear from the nurse on the team. I'd like to turn it over to Mike to pick it up from here. And I guess we need to make sure Mike is not muted.
There you go. Hi, everybody.
Ah.
Thanks for joining us today. Intermediate care is a blend of custodial and supportive nursing care. It's a lower level of care and usually requires intermittent or more frequent care, both in the day and the nighttime. It's often appropriate for those with dementia or need challenges with their ADLs. If at the end of the presentation, you guys can ask questions because the level of care often can become confusing. I kind of look at it similarly to there are retirement plans, but in retirement plans, there are annuities and IRAs and Roth IRAs and 401s. So they all kind of have some overlap, but they are actually all different. Let's see. So going back to that slide. Going on to skilled nursing care. Basically, the difference between skilled nursing care and the other levels of care we described, there has to be a lot more nurse delegation involved. Skilled nursing care, you would often hear of the term short-term rehab, and skilled nursing care will include a lot more nursing interventions as well as PT and OT. So someone who has a stroke or a fall with a broken hip will often go to skilled nursing to get the rehabilitation. And skilled nursing can also include things like care for diabetes, tube feedings. They might have a urinary catheter. Next slide, please. And so how do you determine the right options? Well, if you have access to a certified case manager, that's an excellent first step. The case manager will usually determine the level of need, and they'll go through the ADLs. Things that we also look at include, do they have the capacity for self-preservation if they were left alone. Is care needed throughout the night, or are there times during the day when they can safely be left alone? Is it reasonable for them to be alone for certain periods of the day? The case manager will also determine the need for medication supervision. And a lot of situations we come across, the family is capable of providing a good deal of the care, but if it puts the family and the family caregiver at risk for their health and their safety, you can not only get burned out, but you can actually hurt your back, and then you won't be able to provide the care. So a case manager is an ideal person to turn to help determine these decisions. Next slide, please. So some families will opt to try caring for the individual themselves first, but it doesn't usually have good long-term success unless you have a really big pool of family to pull from. Then you can also get home care from private agencies, so caregivers can come into the home. Adult day programs are another option. They can provide supervision, meals, activities, and companionship. So I do have friends that will still continue to work when their parent with dementia lives with them, and they'll actually drop off the parent at the adult day program on their way to work, and they'll pick up their adult parent on the way back home. I try to avoid calling it adult daycare. I don't think I would appreciate somebody telling me I'm going to daycare. So adult day program is a lot more palatable, but it's kind of ingrained in our lexicon to call it adult daycare, unfortunately. Next slide. So options for nurse aid care. Again, the family can provide the care, or there can be a trained caregiver from a home care agency who comes in. An important distinction, you see the word CNA, Certified Nurses Aid. So people will go to an established program to earn their certification. You will find a lot of caregivers from agencies coming into the home who are no longer certified. What does that mean? Does that mean a nurse aide with a CNA certification is better than somebody who doesn't have a certification? Because there is a difference. And if you talk to the caregiver, you will sometimes find that they do have their initial certification, but they were not able to maintain the certification. So that doesn't mean they cannot provide good care. It just means that they didn't meet the requirements to maintain the certification. And in Hawaii, one of the requirements is you have to have a number of work hours in a facility to maintain the certification. So I know a lot of very good caregivers who are very qualified, but just can't maintain their certification. I think something changed with our screen here.
What happened to our PowerPoint? Yeah. I'm not sure what happened here.
Yeah, I'm not either. Okay.
It looks like this person who is being admitted somehow is sharing
shared
their screen. Yeah, by accident. So we need her to stop sharing. Oh wait, I can.
Okay, got it.
That.
Okay.
I did it.
Oh, yeah.
Okay. There we go. Sorry about that, folks.
Okay, well, I'll talk a little bit about adult day health programs, because that is different from the adult day care program. The main difference is adult day health program will provide more care that's supervised by an RN. So someone who has diabetes and is required to have insulin throughout the day would go to an adult day health program because the RN is there for supervision. An adult day care program might be able to help with some toileting, but there are things that would need to be supervised by an RN, such as medications.
I hate to interrupt, but
Yes.
am I seeing the screen? Is the PowerPoint up on your end?
Oh, you're not
I think
seeing
you gotta
it.
share.
Okay. Let me figure out what happened here. Okay, give me a break. Give me a sec. Okay, is that
There we
better?
go. There we go.
Okay, I'm going to go back to there. Hopefully that works.
Okay. So we can go to the next slide, please.
Okay.
So one of the other options for care in our community is Adult Residential Care Home, or ARCH. They're known by different names in different states, but in Hawaii it's called the ARCH. That is when an individual will remodel their home and actually be able to accept patients licensed by the state of Hawaii. So some of them have 3 beds, some of them have 5. Occasionally they can have a few more. They are licensed by the state. And then we have assisted living care home or communities such as Kahala Nui, the Plaza, Ilima Lehano. And those are places where you can start off at an assisted level where you require a little bit of help, but not a lot of personal care. And then, let's see, intermediate care. So in the home setting, it would be having a RN visiting from the agency, or in a care home setting, it'd be what's called an expanded residential care home. And you can look at the ARCH care homes as being able to provide several levels of care. You could move to an ARCH in just an assisted capacity where they're providing the food and doing your laundry and your housekeeping, but you don't have any personal care. And then you can transition to what I kind of look at as level 1, where you need a little help with showering and changing your clothes. And then we go to level 2, where the person, this is the expanded level, where they need a lot more help. They could not live without supervision. They may have wandering behaviors. They would not be able to manage their medications. Some of them need help with everything. So the expanded level would include all the way up to somebody who's bedbound and needs to be turned and changed frequently. The ARCH level of care, the expanded level, also requires a monthly case management visit from an RN for an additional fee, and that's mandated by the State Department of Health. Next slide, please. So we have places, the assisted living community, assisted living home would be places like Kahala Nui and a couple of the Plaza locations, as well as Craigside and Arcadia. They have what's called extended care. So they go above the assisted living. So that's kind of like your level 1 and your level 2 of expanded care. They just call them different things in different facilities. And then you have community care foster homes. So I call them foster care homes. That's kind of like the old term for them. But essentially, that's somebody who remodels their home and is licensed by the state to accept either 2 or 3 individuals who need care. So they can take individuals at the assisted living level of care, where you don't need much personal care, all the way up to what I refer to as expanded or level 2, where they need complete care. Those are also licensed by the state of Hawaii. They also have RNs who are involved in the case management. And interestingly, those are the settings that can take Medicaid or private pay. Sometimes they have a mix of both. When you talk about places like Craigside, Ilima, Lehano, and the Plaza, Kahala Nui, they do not take Medicaid. There are places like Aloha Nursing and Rehab in Kaneohe and Halinani that can take basically all levels of care, and they take most forms of payment. I cannot say all forms of payment because some of them, their restrictions on accepting Medicaid patients are really strict, or they only have a few beds allocated to that. I don't know if you all know that Kahuku, the old Kahuku Hospital, has a care home attached to it. They can accept Medicaid patients, but their criteria are kind of limited. So, and we just wanted to throw in that there are still, to this day, unfortunately, private unlicensed care homes providing services to our residents. They were made illegal by the Hawaii legislature in 2018. I don't know if you remember seeing the news article back in either November or December that a Pearl City nursing home was ordered to close down, and they were issued a huge fine by Department of Health. And my thought was, that's too bad that people are still doing that. And then last month or earlier this month, I heard that they found they were still providing care. So there's a lot of good reasons for you to reach out to a certified case manager or elder care coordinator to help with your placement. Next slide, please. So some of the other options for skilled nursing care are, again, having an RN come in for a home care agency. And then you have the skilled nursing facilities such as Oahu Care Facility, Aloha Nursing and Rehab, Halenani. And people often go there after a major illness. Those places, a lot of their focus is on rehab, a short-term stay paid for by Medicare, 100 days max. But they also have a mix of private pay and Medicaid patients who are long-term. Those facilities usually have their focus on PT and OT and speech. So I guess if the easy term to use for care that's outside of your home and is in a facility is a nursing home. So Aloha Nursing and Rehab and Halenani. If they are in somebody's home or private home where there's a smaller number of patients or residents, then they're referred to as an ARCH or a community foster home. And long-term care facilities, Pololo Chinese Home does take short-term rehab, and they also have long-term patients there who are no longer in rehab. And if any of you are sitting here going, oh my God, then join the club, because that's most of the people on the island trying to struggle with all of these decisions that they need to make for their aging parents. And there's a reason why they offer a nationally board certified case management certification, because you have to understand all of these different dynamics. Next slide, please. Specialized memory care. I would say the majority of nursing facilities, care homes, arches, and foster care do have some knowledge on caring for people with memory problems. Dementia is the most common memory problem out there. But I would probably say that not all of them are experts in it. So how do you determine if they're an expert in it? Next slide, please. If they're an expert, that means they have a lot of experience, and not just experience, but I would say successful outcomes with their patients. It's going to be a secure facility where they can't accidentally slip out the door and wander down the street. I did work at an arch where they seemed to run a very good program, but I found out pretty quickly that they were not, I wouldn't say they were experts in memory care, because they had one lady that escaped twice in 6 months, and the neighbor brought her up the street, thank goodness. So really it has a lot to do with caregiver experience and the training that the staff receive. There are a couple dedicated facilities like Hale Kuiki that were built specifically for dementia care and memory care. I will throw in the certified case managers that I work with. One of the things we want to find out, in addition to what level of care an individual needs, if they need help finding a place, is we actually go out and interview the care home operators. The process for selecting a facility such as the Plaza or Halenani is a little different. And when we talk about a foster care home versus an arch, which is in a residential setting, I will go out and interview the caregiver, find out what kind of experience they have. There's certain things I ask them about to determine how they handle certain situations. And there's a lot more to taking care of somebody in a residential setting than making sure they have their meals and their medications. I find that some of the better run arches actually have a number of residents who graduate from hospice. And if you're familiar with hospice, it oftentimes deals with somebody with a terminal condition where they're not expected to live beyond a certain number of months. And it's quite interesting. I don't have a lot of data on graduating from hospice, but I've run into a number of care homes in a residential setting where they've had more than one resident graduate from hospice and go on to live for a number of years before they eventually succumb to their disease. Next slide, please. Continuing care retirement communities. These places are a little different because you buy in at a certain price, and then the intent is for you to start at an assisted level of care and then progress through all the levels of care through the end of your life. So typically it's a buy-in. Kahalanui's in that boat. I believe Arcadia and Craigside are as well. They're a little different than places like Ilima and the Plaza. So they provide care as the needs change, and those are the examples. Hospice, by the way, I don't think we have it on our slide, but hospice can be provided in any of the care settings that we've mentioned. It can be at home, it can be in an arch or foster care. Next slide, please. So assisted living, again, you go in with very little need for any help, and they're actually good places for people who want to continue to be independent because there's a lot of activities and socialization for them. Meals are provided, usually housekeeping and transportation. And the caveat for assisted living communities is they must be ambulatory. Assisted living is just not set up to provide that level of care to help somebody who's not ambulatory. Next slide, please. They're not appropriate for people with severe dementia or behavioral issues such as wandering. Some can offer the next level of care, so you can start at assisted living and then move up to a slightly higher level. But just to make it real confusing, some you can start at assisted level and go up to a level where you need a minimal level of assistance, and then once you get to a great level of assistance, then you need to move. So that's quite difficult. Some examples are the Plaza, Lima, Lejano, Kalakaua Gardens, and Puahenani. So let's see. There's a lot more out there, by the way. Next slide, please. So one of the things that a certified case manager can do for you is to look at the licensing to make sure they're actually a licensed residential setting. Here we have the link to the government listing. And then next slide, there's another one that has to do with inspection reports for some of the skilled nursing facilities. So this is a mandate from CMS and Medicare, and you can actually log on to see what their inspection reports are. So these are regarding the facilities. When you talk about residential settings like the foster care setting and the arch, they are inspected by the State Department of Health once a year. They go through a pretty rigorous inspection, and you can actually find their deficiency reports for each residential care home on a website. So one thing to know is where to find those deficiency reports. And the other thing to know is how to interpret them, because some deficiencies are for relatively minor items that don't impact care to a great deal, but they're still a deficiency. And then others are pretty serious deficiencies. And so that's where you can find those. Are we at the end, Laurie? We're at the end.
We are.
Congratulations. I hope nobody fell asleep during the last part. There was a lot of information flying around. And now you can kind of see why I brought up the comparison for the retirement accounts, because they're different in different ways. And now we are open to questions.